Every day, healthcare professionals like you provide compassionate care to patients and families. But sometimes emotions can run high in healthcare settings. Patients or visitors may become upset, fearful, frustrated, and in some cases, those emotions turn into aggression. Your safety is essential. In this video, we'll share practical tips to help spot warning signs and to keep you and your team safe when tensions start to build. One of your most powerful tools in preventing workplace violence is awareness. Aggression rarely happens out of nowhere, it typically builds up over time. Watch for early warning signs like a raised or angry tone of voice, tense posture or clenched fists, pacing, fidgeting, or refusal to follow directions, heavy breathing or punching one's own hands, large, exaggerated gestures, sweaty palms or rocking side to side, looking around trying to find an exit, or adopting a fighting stance. If you notice any of these signs, that's your cue to take a step back, call for support, or use de-escalation techniques. Recognizing these cues helps you stay prepared so that you can respond calmly and confidently. Here's a quick safety tip when talking to others. Try to identify that person's dominant side. That's usually the side that they'll lash out on. You can usually tell which one it is by noticing which hand they use to point, write, or eat. Additionally, people tend to wear their watch on their non-dominant hand. If you're unsure, just remember, about 90% of people are right-handed, so their right side is likely their dominant side. Whenever possible, steer clear of that side. Situational awareness is key to personal safety. When walking through the hospital, especially around corners or into new spaces, look up from your phone, remove your earbuds or headphones, and take in your surroundings. It only takes a second, but can make all the difference. Remember, a distracted person makes for an easy target. Keep your hands out of your pockets as well. This improves your reaction time and projects confidence, making you less vulnerable. When you enter a room, pause for a scan. This short pause allows you to read body language, note where people are located, and get an overall sense of the mood before you engage. Think about who's in the room. Does anyone seem upset or anxious? Where are your exits? And is your path clear? Avoid any distractions. Don't check your device or charts until you've assessed the environment. Body positioning matters. Always look ahead and make eye contact with others. Maintain a reactionary gap, about 6 feet or 2 arms length of space between you and the other person. If you need to move closer, use the interview stance. Keep your dominant leg slightly back, your feet shoulder width apart, and your body at an angle so that you're not directly facing the person. This position keeps you balanced and ready to move if necessary, while appearing calm and non-threatening. Always keep people in your line of sight. If you need to move, reposition yourself so you can still see them clearly, and avoid turning your back to anyone in the room. Try to stay just out of reach whenever possible. Avoid leaning over your patient, and be mindful that in certain situations, your stethoscope could be used against you. You may want to keep it in your pocket instead of around your neck. With practice, these techniques will become second nature. Identifying potentially risky patients early is essential to maintaining safety. When reviewing a patient's history, pay attention to any past or current diagnosis that may increase the likelihood of aggression. Patients with dementia, traumatic brain injuries, or certain psychological conditions, such as behavioral health challenges, antisocial personality disorder, or substance use disorders, they may become aggressive when confused or distressed. However, aggressive behaviors can occur in any patient that is upset, overwhelmed, or in a crisis. Keep your voice low, slow, and steady. Use simple, respectful language and avoid medical jargon. Don't argue or interrupt. Listen actively and respond calmly. Allow extra time for the patient to process information. Acknowledge emotions and offer reassurance. I can see you're frustrated. I want to understand what you're feeling. It's important to me. Encourage the patient to share their perspective. Please tell me what happened, and tell me more about what you're thinking. When possible, Offer choices instead of ultimatums. This will support a sense of control. Would you like to sit while we talk or remain standing? I can't explain what's happening. Would you like to go over it now or after you've had a moment? You can tell me what's bothering you first, or I can share what I know. Which would you prefer? Providing choices allows the patient to feel very empowered while you maintain safety and direction. Your physical presence communicates just as powerfully as your words. Use body language that signals calmness, respect, and safety. Keep your posture open and relaxed. Keep your hands visible and out of your pockets. Avoid any sudden or abrupt movements. Stand at a slight angle rather than directly facing the person. This reduces perceived confrontation. Maintain a safe, comfortable distance. Give the patient their personal space. Align your body language with your tone of voice. Calm communication paired with calm posture. These strategies help reduce tension and build trust. This creates an environment where verbal de-escalation can be effective. Adjusting the surroundings can significantly lower agitation and risk. Reduce noise, crowding, and unnecessary stimulation. Provide personal space and avoid making the patient feel cornered. Keep exit routes clear for safety for both staff and patients. Remove or secure objects that could become unsafe if the situation escalates. When appropriate, guide the patient to a quieter, calmer space to talk. Environmental modifications work hand in hand with verbal and nonverbal de-escalation. This supports safety and rapport. Even familiar places can present risks. Imagine you're stepping into the elevator that you use every day, eyes glued to your phone. You didn't make eye contact, you didn't assess. Always remain alert and aware of your surroundings. Make eye contact with others. This shows confidence and that you could identify that person if needed, which attackers want to avoid. This position gives you immediate access to the emergency buttons, the phone, and the alarm. It also keeps everyone in your line of sight, so you have more time to react if needed. If something feels off, trust your instincts. Don't get in the elevator or step out and wait for the next elevator. If you believe that someone is going to become violent, leave that area if you can, and follow your facility's violence prevention protocols. They exist to protect you and your team. After any aggressive or violent incident, even if no one was hurt, report it. Reporting helps your organization track trends, strengthen policies, and support staff. It's not just paperwork. It's how we build a safer workplace for everyone. You dedicate yourself to caring for others every day. Remember, your safety is just as important as your patients. By remaining aware, prepared, and confident, you help provide a safer environment for everyone.